أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين. Now today again it is case number 2, reporting X-ray, which I am doing plain X-ray. A series of 5 or 7 X-ray I will report one by one, so you can understand well the problem which the X-ray actually. Plain X-ray is one of the diagnostic tools we have. I am actually Professor Ali Haider speaking to you on behalf of my platform actually, which is MIPME, that is the movement to improve the medical poverty of the medical education, and there is a website personal to me in which I am actually feeding the different lectures which I have given previously, and it is, I think it is more than 450 or 500 and probably more than 2,000 to 3,000 BCQs in it. I will gradually feed in the website, but gradually, of course. So the next one is there's a case when number 1 was described previously. Now this is reporting XHS2. A 32-year-old female presented with the diplopia and increased fatigability and at the end of the day for the last 2 years. On examination, temperature is 98 degree, pulse 87 per minute, BP was 110/70, and respiratory rate 10 per minute. It is reduced. Power of the limb muscles 6/6 as the resting, reduced to 4/6 after 2 minutes exercise. After physical exercise of 2 minutes now, the power is decreased. While the diplopia noted on the horizontal gaze and vertical gaze or eyeball movements. Now investigations, hemoglobin is 10 gram, TLC is 4,300, blood test was 4,20,000, ESR 76 is raised, and RBS, blood sugar was 165. The borderline, you can do the OGTT in this case to diagnose whether it is associated with the condition associated with diabetes. Urine RV was normal and routine X-ray chest done, and it is presented in front of you. Now report this X-ray with clinical profile provided. One of the best, how it is written, look, it should be given in the OSCE examination or close examination like this should be the fashion. The clinical data is provided. On the basis of this, the X-ray chest will be reported. Now I am reporting this chest. Now report is Skygram 3. So the requirements were fulfilled or not? It is the PA view, yes, it is a PA view, because there is mask, the spine is masked. The second one, S, it is standing, yes, it is standing, first rib, second rib, third rib, fourth, fifth, sixth. The right dome of diaphragm in the 7th, the standing patient. Is straight to spinal processes. One spinal process is this: make one line here, draw, and it's a look lateral joint, upper part, draw another line. There are 2 lines now, 90 degree here, 90 degree here. If it is, these are on 90 degree, it means the patient is in a straight position. Third one is that patient is still, means deeply inspired and hold the breath properly. What you see is there is increment of the dome of the diaphragm, and actually the thing is this, and to hold the breath properly, means the bronchovascular markings are clearly visible. If the person expires, then they are blurred. Quality film is good, it's a full film. Now another thing which we do is the bony skeleton, the clavicle, the spinous, and the first and second rib, third rib, fourth rib, fifth rib, and the midclavicular line, the intercostal spaces should be 2.5 centimeter in width. If they are decreased, look, it is decreased or not, I don't know. You have to measure it from here to here. Whether it is less than 2.5 centimeter means it is a restricted lung disease. If it is more than 2.5 centimeter here, or here, it means that it is a obstructive lung disease. So this is the scapula, the lateral border is, medial border is here and here. Okay, fine. Scapula, there is no problem. Shoulder vagina, there is no problem. Cervical spine, the intercostal, the intervertebral spaces are seen here, some of it. And there is no accessory rib present. The cervical rib is not present. So, and it is not related with the clinical scenario is concerned. Soft tissue shadows here you see dome of the diaphragm is left side and the right side, and on the lateral wall and the above it you can see the neck area where soft tissue shadows, and this part is a soft tissue shadow also. Here it is. This part, superior mediastinum. This is a soft tissue shadow. It is a shadow, yes, definitely. And this is a shadow. It's a soft tissue shadow. It is coming. This is the margin of the aorta. Here this is going on like this. Look, my cursor is moving like this, and this, and this, and coming back. It means that it is a superior mediastinum or an anterior mediastinum, definitely, this thing. Some of the part is in superior mediastinum, but rest of the inferior mediastinum, probably. This is called the sailing sign. At one time, the ships are sailing with the help of the clothes. Very thick clothes are used. And they direct the ship towards with the help of the breeze. This is a sailing sign. Now this sailing sign is present in case of one thing, and that is thymoma. Thymoma. This is the hard data of it. Although it may be differentiated with other tumors in the anterior or superior mediastinal tumors. Any tumor can arise from here, any type of the mesenchymal tumors. Possibility, because lymph nodes are not present here. I don't want to discuss the thymoma is enlarged here or something like this. Definitely it is enlarged, maybe it is thymoma. I don't know about it because the biopsy will not be taken. Thymoma. Thymoma is present in this condition. And afterwards I will say the trachea is in central in position, central. The lung fields divided by second postal cartilage here, one line is drawn. The fourth rib, one line is drawn. So there will be upper, middle and the lower, upper, middle and lower. There are 6 lung fields. There are 6 lung fields. In case you see the proportion of the bronchostal markings is aerogram. 2 things are normal. The third one is abnormal, that is alien, that is radiopacity, which I have discussed in my sessions 5th or 6th. Very detailed account has been given. Although people don't like these type of lectures, but you have to learn it. Because you are a clinician and you have to report very correctly. Do not depend on the radiologist, please, because he has not seen the case. After the middle of the dome of the diaphragm is flat here. Flat, it is not curved one. There is something, pressure is going on because of the superior mediastinum there is a mass, and the anterior mediastinum, probably due to this pressure, it is possibility of it. The costophrenic angle, cardiophrenic angle are normal, but the proportion to the right and the left is reversed. Here is the gas shoulders, gastrorograms, pushing the left dome of the diaphragm upwards. Right dome is upward, usually left dome is downwards, but here is vice versa because of the high pressure in the stomach. The 2 shadows are seen. And this is called gastric bubble syndrome. In my knowledge, as I have learned previously, that if there is a collection of gases in the fundus of the stomach, it will push the diaphragm. Because the heart is very near to it, people think that it is a heart problem because people feel uneasy. This is called gastric bubble syndrome. Gastric bubble syndrome. Possibility of it. The middle mediastinum is divided into two, where the upper, right border is changing in direction, and the right border is changing in direction here. So line will be made here. It is slightly oblique line. So size of the middle mediastinum means heart size. It is normal. I measured it. It is normal. The shape of the middle mediastinum, the left border here, it is very, very straight type of thing, because the push from above, the straight one, and it is a globular type of a right border. It means that it is normal. The upper part of the middle mediastinum is divided into four arbitrary for learning purposes. This one I have divided into four. First part denotes the ascending aorta, the second and third, the arch of aorta here, aortic knuckle, and then this is the part, the fourth part is here, and this is pulmonary conus. It is normal. It means that we cannot comment on it. And then afterwards, the left hilar, the size is normal, the shape is normal. The right hilar, the size is normal, the shape is normal, it is T-shape. Upper branch, lower branch, configuration of the bronchovascular marking in the lower zone is normal, and this is stem. So it is a T-shape, laterally, C-shaped inverted left hilar. Normal, there is no lymphadenopathy, no peritracheal lymphadenopathy is seen. Now, after all, I have actually, all things are covered by me very quickly. So, inference there is a soft tissue shadow in the superior as well as anterior mediastinum, part of it, and it has got what is called the border are slightly irregular, although it is slightly here, it is irregular. We don't know. We have to do the HRCT to confirm it and then go to the biopsy. And this is a saline sign in the plain radiography, thymoma. Thymoma is related with the condition which is known as myasthenia gravis. Specifically, if the eyes are involved, myasthenic eyes, that is called. Myasthenia causing the eye problem, the weakness of the eye muscles. Then it is related with the thymoma in most of the cases, 80%. If you remove it by surgical means, it is much beneficial. And the other types of myasthenia where the peripheral limbs are involved, eyes are minimally involved, the surgical resection is not very helpful. So this is the interpretation. So you do, after inference, you write it down, whether you want to refer it, yes, you refer to the surgical team, or you are referring to a neurologist, whatever it is. But I will not refer. I will go for the other tests, the lateral view, the HRCT, to see it, and I will go for the anti-tensilon test, anti-mitochondrial and anti-cholinesterase antibody, acetylcholine receptor antibodies. I will do these things. And then I will go for the EMG, electromyography. Decremental, I guess, always. Incremental आता है Lambert-Eaton syndrome में, which is associated with the malignancy. So I will do like this, and I will confirm it, and patient is consented, I will remove it to give benefit. Although in 20% cases of the peripheral myasthenia, it is not benefited, but it should be removed because it will convert into carcinoma. You have to remove it anyway. Benefit of the eye are benefited. Myasthenic eyes are benefited, even cured in some cases. You give the definitely cholinergic drugs in the pharmacological treatment is concerned, and you give, if they are failed, steroids, the gamma globulin, you can give also, and it is an autoimmune disease because it's part of it. You can go for the immunosuppressive therapy even. So this is the case which I have presented. I hope that it is a very, very summarized way of presentation, and I hope you like it. Please comment on this. If you like, please click on the like. If you haven't subscribed yet this channel on YouTube, please subscribe this channel. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. Inshallah, we meet you tomorrow with another X-ray. Assalamu alaikum wa rahmatullahi wa barakatuh.